Okay, this is now where we're going to talk about lumbar discectomy. Lumbar discectomy is a very common spinal operation. It's done for sciatica or radiculopathy, which is a pinched nerve. So if you have a pinched nerve running down your leg and it's not responded to the normal treatments, therapy, medicines, maybe injections, you might be a candidate for a lumbar discectomy. This is a model of a spine, and it shows the bones and the discs, and in the back is the spinal canal where the nerves are. And the discs are the shock absorbers, and this is a model of a disc, and they're squishy. It's kind of like a steel-belted radio. You've got a hard outer surface and the squishy middle part. When a disc herniates, the squishy middle part scoots out a little hole and starts pressing on the nerve, which is what you see on this model. See the nerve and the disc herniating out. So what we do during the operation is we make a small incision on the spine. We go down, we pull the muscles off to one side. We remove a little bit of bone and some thickened ligament, generally right over top of the disc. We find the nerve, pull it off to the side, and then take this part of the disc out. We tend not to take the entire disc out because that's a much bigger operation. We take just this part that's pressing on the nerve. We have a lot of special equipment we use these days. It used to be the incision was relatively big, but now the incisions are getting smaller and smaller. Usually we can keep them under about 2 inches, sometimes even closer to an inch. It all depends on the circumstance, the level, and the patient's anatomy. When you have this operation, you go home the same day. When you get home, you're able to take care of yourself at home, but you're taking it easy and resting and not exerting yourself. Anytime you have this type of operation, there is a risk of spinal fluid leak, infection, risk of needing to have more surgery in the future, chance that the surgery won't work for whatever reason. All those are very uncommon. Probably the most common thing we see is a repeat disc herniation, and that's where more of the jelly comes out the same hole, and that happens in about 1 in 10 people. It can happen the next day, or it can happen many years down the road. So that's a lumbar discectomy or micro discectomy.